Hi everyone, welcome back to my YouTube channel, and today we are going to talk about chronic alveolar abscess. So let's start our topic with introduction. Chronic alveolar abscess is a long-standing localized infection of alveolar bone at the apex of the tooth. It is usually associated with pulpal necrosis or chronic periapical inflammation. Unlike acute abscesses, chronic alveolar abscesses often progress slowly and are usually asymptomatic, but may lead to fistula or sinus tract formation that allow pus to drain into the oral cavity or skin. Definition: Chronic alveolar abscess is defined as persistent localized infection of periapical tissue of non-vital tooth characterized by formation of sinus tract or fistula and minimal or intermediate symptoms. Etiology: Chronic alveolar abscess usually develops due to untreated pulpal necrosis or inadequately treated periapical infections. Causes include pulpal necrosis, that is most common cause, bacterial toxin from necrotic pulp, chronic irritate periapical tissue. Second cause may be untreated acute apical abscess, that is acute apical abscess may become chronic if drainage occurs and systemic symptoms resolve. Third is iatrogenic factor, that is incomplete root canal treatment or oval-filled canals. Fourth is trauma, that is chronic irritation from fracture or luxated teeth. Pathophysiology of chronic alveolar abscess. Necrotic pulp allow bacteria to reach periapical tissue. Then there are inflammatory mediators that cause slow bone resorption in the apex. As a result, pus formation occur. Blood pressure is relieved through a sinus tract or fistula, preventing acute symptoms. Chronic inflammation may lead to granulation tissue formation and sometimes periapical granuloma or cyst. Clinical features include symptoms, signs, and tooth examination things. Symptoms are there. It is often asymptomatic or mild discomfort is there. Occasional pain or tenderness is there if in case of secondary infection. Signs include sinus tract or fistula on the gingiva or alveolar mucosa that is often near the apex of affected tooth. Discharge of pus which may relieve pressure and pain. Tooth is usually non-vital and there is minimal or no swelling unless secondary infection develops. Tooth examination is done by percussion that may show slight tenderness, and tooth may have previous restorative work or decay leading to pulpal necrosis. Radiographic features: well-defined periapical erudiency at the apex of the affected tooth. Borders may be corrugated indicating chronicity. Bones surrounding the lesion may appear sclerotic. Sinus tract course may sometimes be traced using gutta-percha points radiographically. Microbial factors: Maize infection are common, predominantly anaerobic bacteria, that is Porphyromonas, Prevotella, and Fusobacterium. They may be facultative anaerobes that include Streptococcus species. Chronic inflammation is maintained by persistent bacterial toxins. Differential diagnosis: it is from the periapical granuloma. In that case, chronic lesion is there but without sinus tract. Second differential diagnosis is periapical cyst that may have similar radiographic features. Third is periodontal abscess that originates from periodontal pocket. Fourth is odontogenic tumor or bone lesion. It is rare but considered in large or atypical lesions. Management include elimination of infection, sinus tract management, antibiotics, and sportive care. Elimination of infection is done by root canal therapy, that is first line treatment to remove necrotic pulp and disinfecting canals. Extraction may be indicated if tooth is non-restorable. Second we do is sinus tract management. Sinus tract usually resolves spontaneously after successful endodontic treatment. Surgical excision may be required if it persists. Third is antibiotics, that is generally not required unless there is secondary infection or systemic involvement. Fourth, we can do sportive care that include warm saline rinses and patient education on oral hygiene and follow-up. Prognosis is excellent if sources of infection is eliminated. Healing may take several months with bone regeneration at the apex. Untreated chronic alveolar abscess may persist indefinitely, causing bone destruction or secondary acute infections. Clinical significance: Chronic alveolar abscess is a common endodontic problem that may remain unnoticed due to minimal symptoms. Early recognition and treatment prevent chronic bone loss, tooth loss, and systemic complications. Sinus tract formation provides a natural drainage pathway which may mask the severity of underlying infections. Conclusion: chronic alveolar abscess is a persistent, low grade periapical infection that is often associated with non vital teeth, and it is characterized by sinus tract formation. Its diagnosis relies on clinical examination, pulp testing, and radiograph, and treatment involves root canal therapy or extraction. Early intervention ensures resolution of infection, healing of periapical bone, and preservation of oral function. And this was all about chronic alveolar abscess. Hopefully you like the video. If you do, don't forget to like, share, subscribe, and comment. Thank you for watching.